If you don't pay attention to these signs in your body, you will develop diabetes in the next few months. Before we develop diabetes, our body shows us a series of alarms and signs to let us know that if we don't think of a solution and if we don't take them seriously, we may develop diabetes in a few months. In this video, I will briefly explain the 10 most important early signs of diabetes to you, and at the end, I will explain some practical solutions to you so that you don't develop diabetes by doing them. Hello dear friends, welcome to a new video. Let's see what these symptoms are. The first sign is an unusual increase in appetite. One of the first signs of prediabetes is an unusual increase in appetite, especially cravings for sweets and carbohydrates. This condition occurs due to high blood sugar fluctuations. The body secretes a lot of insulin to control blood sugar, but the cells do not respond to this insulin, which is called insulin resistance. As a result, sugar does not enter the cells properly and the body thinks it does not have enough energy, so a constant feeling of hunger occurs. The second serious sign is increased fatigue and decreased energy throughout the day. Feeling constantly tired even with enough sleep can be a sign of insulin resistance. In this condition, glucose is high in the blood, but the cells are unable to absorb it, so the body faces a lack of energy. This disruption in energy supply causes a feeling of lethargy, decreased concentration, and general weakness. The third serious symptom is frequent urination, especially at night. If you have been urinating more frequently at night for no apparent reason, this could be a sign of high blood sugar. When your blood sugar is high, your kidneys are working to get rid of the excess sugar, which leads to increased urine volume. Frequent urination is one of the early signs of prediabetes and diabetes that should not be ignored. The fourth serious symptom is unusual and constant thirst. Due to frequent urination, your body loses a lot of fluids, which causes a constant feeling of thirst. Even if you drink enough water, you may still feel dehydrated or thirsty. This cycle between losing water and feeling thirsty is a sign of poor blood sugar regulation that is seen in the early stages of diabetes. The fifth serious symptom is darkening of the skin in creased areas such as the neck and armpits. This symptom, called acanthosis nigricans, is one of the early warning signs of insulin resistance. Excess insulin in the blood can stimulate the growth of skin cells and overproduction of pigment in the skin. This condition is usually seen in the folds of the neck, armpits, or groin. The sixth serious symptom is drowsiness or lethargy after eating. If you feel sleepy or lethargic after eating a heavy meal, especially one high in carbohydrates, this may be due to excessive insulin secretion and a sudden drop in blood sugar. This phenomenon indicates a disorder in blood sugar regulation and is a common symptom of prediabetes. The seventh serious symptom is weight gain in the abdominal area or abdominal obesity. Excess fat in the abdominal area is directly related to insulin resistance. This type of obesity causes inflammation in the body and makes cells less sensitive to insulin. In fact, abdominal obesity is both a result and a cause of insulin resistance, creating a vicious cycle that ultimately leads to type 2 diabetes. The eighth serious symptom is slow healing of wounds and scrapes. If simple wounds or scrapes on your skin take longer than usual to heal, this could be a sign of the onset of impaired blood flow and immune system function, which is a sign of insulin resistance. Over time, high blood sugar damages small blood vessels, preventing oxygen and nutrients from reaching tissues properly. This slows tissue repair and increases the risk of infection. The ninth serious symptom is occasional blurred vision, especially after meals. Changes in blood sugar can affect the lens of the eye, causing changes in its thickness or shape. These changes can lead to temporary blurred vision. If you experience blurred vision after eating or at certain times, this may be a sign of a sudden increase in blood sugar and lack of insulin control in the body. The 10th serious symptom is a tingling, numbness, or prickling sensation in the hands and feet. This symptom, which is usually felt in the fingers and toes, can be one of the early signs of diabetic neuropathy, which can also begin in the prediabetes stages. High blood sugar gradually damages nerve fibers, and this damage first manifests itself as tingling, numbness, or even pain in the limbs. Paying attention to this symptom is very important because it may appear before the official diagnosis of diabetes. But the best way to avoid getting diabetes is to use the strategies that I will tell you below. Stop eating sweets and sugary drinks, rice, and white bread. Exercise, and if we can't, walk for 40 minutes in the morning and 40 minutes in the evening. Change your lifestyle and diet and eat more protein and high-fiber vegetables. Manage and control stress and sleep. Drink at least 2 liters of water a day. Count calories and calculate the calories you eat and consume so you don't gain weight. These were the most important ones, and I'm trying to make a video about this. I hope you enjoyed the video and it was interesting for you.